My name is Bayle Conrad, and I'm a program coordinator at Harborview Medical Center. This is a series of presentations on applying for SSI benefits for newly arrived refugees and other similar immigration statuses. This presentation will cover the DDS process and the Adult Function Report. Let's start by talking about DDS, which stands for Disability Determination Services. This is a state agency that partners with the Social Security Administration to determine whether an SSI applicant is disabled under SSI rules. Basically, once the claimant completes the SSI interview, you've sent in all of the additional paperwork, and Social Security has determined that they meet the income eligibility and they're not over income. The case is then sent to Disability Determination Services, or it might be called something slightly different in your state, but it's a state agency that's going to actually make the disability determination. I find it helpful to know a little bit about what DDS does to help familiarize yourself with the process, especially if you're new to doing SSI claims. So basically, Disability Determination Services, like I mentioned, they complete the disability determination for Social Security, and they do this by collecting and requesting the claimant's medical records directly from the clinics that you've listed in the disability report when you first started the application. DDS is the agency that will send out the adult function report, or if it's for a child function report, for the claimant to complete and return. And we're going to talk about this form in more detail through this presentation. If they do not have enough information after getting that report back, looking over the medical records and reviewing the entire kind of application packet, DDS at times will arrange a physical and or mental health examination by a third-party provider. This is a person who has not seen that claimant before, and we'll talk in a few slides about what this appointment looks like. Once they have made the determination, either by just looking at the medical reports, the adult function report, and or also having a third-party provider do an examination of your claimant, they will then make a decision on whether the claimant meets the definition of disability and sends the decision back to Social Security. So if you're calling for a status update on your case and the representative from Social Security tells you, oh, the case is now with DDS and we should expect a decision in 3 to 4 months, this is the point of the SSI process where the case is currently at. And if you're not clear on how Social Security works with DDS, it can be really confusing to know that there are multiple agencies involved in this entire process. I want to spend some time talking about the adult function report and walking through what that report looks like, because this is one of the most important pieces of information that your client can complete and submit in support of their SSI claim. Usually, when this is mailed to your client, they will have a limited amount of time to complete and return it. Usually it's 10 days. Again, this is mailed out in English and not translated. And so if you have a client who is a limited English speaker, they will likely need assistance completing this form. And it's several pages long. You might be sent a copy of the form to complete from your perspective about the client. If you can remember way back in one of the first presentations about the online disability report, if you are listed as someone who might know about their medical conditions, then you will be sent this form to also complete. And it's important to make sure in that case that you help your client complete the form from their perspective and that you complete the form again from your perspective. Both of those documents will be really helpful in supporting their claim, even if it seems like some of it is duplicate work. One of the reasons why this report is so important is that it really gives the client the opportunity to describe in detail how their medical conditions impact their life on a day-to-day basis that might not be as clear as looking over medical records, for example. So it's really important to fill out this report as thoroughly as possible. The report itself does not give you a lot of room to write in, and so you can attach additional sheets. You can add notes in the remarks section at the end, trying to really make it clear what their limitations are based on their medical conditions can be hugely important in having their SSI benefits approved. This can also be a really traumatic report to answer questions about for a few reasons. One is that a lot of the report refers to the past and how the client maybe was able to do things prior to the onset of their condition. It also might be reminders of the fact that they have fled their home and in many and most scenarios are not able to return home. And so while you have a limited amount of time to complete this, it's okay to kind of see if you need to take multiple occasions to talk to the client about it. You can also look at a copy of this form prior to receiving it and start gathering the information before you get it and have that limited time frame to complete it. It can be a lot of questions and take a long time to get, to help your client fill it out completely. So let's go through what the adult function report looks like. This is the first page of the report. One thing to note is that you should not leave any answer blank. So if there's an answer or a question that's not applicable to your client, you can just write in not applicable or don't know, doesn't apply. But that is one thing that they ask for when doing this report. The start of the adult function report just asks basic general information, name, phone number, where the person lives. And then starting in section B really goes into information about how a person's illness or injuries or conditions impacts their ability to work. So when I have completed these forms, again, you're completing this, if you're helping your client do so, you're completing it on their behalf from their perspective. So you really want to ask the questions directly to that person and see what their answer is. There might be times when you're working with a client who either can't fully answer or maybe doesn't understand the question. And in that case, you can potentially prompt the conversation, maybe saying, oh, you told me last week that you were in so much pain that you weren't able to get out of bed. Can you tell me a little bit more about that and how that impacts your ability to work? So use the knowledge you have and the relationship you have with the client to your benefit and getting the best information you can. You can see on the right side of this page, it starts getting into really detailed questions. For example, the top question on that page is describe what you do from the time you wake up until going to bed. You don't have that many lines to write out what that looks like. And so this is just one of many examples where if there's a lot that you're trying to write, you don't have enough space, use that remarks section at the end to add. You can also add pages if you need to. And then it goes into really more specific questions. You can see question 10 on this slide also asks what I was just mentioning. What were you able to do before your illness occurred that you can't do now? Questions like that are really difficult for people to answer because it reminds them of a time in their life when maybe they were healthier or didn't have the condition or the symptoms that they have now. But they are really important questions to ask and to make sure you get full answers to. There are several sections that are similar to this section at the bottom of the right-hand page here, where it asks you a number of different things like, are you able to dress yourself, bathe yourself, care for your hair, shave? And you have to write in specific answers for every single piece that it's asking. Again, if you run out of room, use that remarks section to your benefit, but you can really just do your best to try to describe what your client is telling you about their ability to do these things. So in the next few pages, you're really getting into the meat of these questions. And again, keeping in mind that part of what Social Security uses to determine disability is, does this person have conditions that limit their ability to work? So kind of keeping that in mind will help you structure this conversation and getting answers to these questions. One example I like to give here is, maybe someone can prepare a meal. You can see that that's a section on the left-hand side here. But maybe they are in so much pain that they can only chop vegetables for every 10 minutes, and then they have to sit down and rest for 5 minutes before starting again. Those types of scenarios are really important to list out here. And you can see there's several prompting questions around how often do you prepare meals? How long does it take you? But, really trying to get the details of what the day-to-day activity for that person looks like can be hugely beneficial. There's a big difference between saying, yes, I can prepare food, and yes, I can prepare food, but it takes me 3 hours because I have to rest so often, when maybe before my illness, it took me an hour. Same with some of these other sections, just really trying to get into more and more details about the person's abilities. And some of them are really broad, like the house and yard work section here on the left, bottom left of this page. It says, list the household chores, both indoors and outdoors, that you are able to do. And it gives you 2 lines to complete that. So that is really not a lot of space for you to describe that in detail. And you might have to ask some prompting questions to your client about the types of chores or work around the house that they are or are not able to do. And then I also want to highlight on the right-hand side, there's some questions here that might be answered a little bit differently by a newly arrived refugee or someone with a similar immigration status. For example, the section 15 around getting around, it asks, how often do you go outside? There might be other reasons why someone doesn't go outside that doesn't have to do with their disability, and it's okay to list that and explain that. So for example, if it's someone who's scared to go outside because they're new to the US and they don't speak the language and they don't read the language, and maybe they're not literate in any language, you can write that. It doesn't have to pertain to the disability. You're just answering the questions, as honestly as possible with your client's input. Another question that's asked, do you drive? A lot of refugees may have never learned to drive. Maybe that's not something that was common in their country of origin. That you can explain here. That might not have anything to do with the reason that they're applying or with their disability, but all of these pieces add up to give a picture of that person's day-to-day life. Same with money. This can be sometimes a shameful question for people who have to tell me, I've never been able to read money, or my husband always dealt with the finances, or maybe overseas I was able to use money because I recognized, what a coin was or what a bill was, but in the US I don't understand the difference between the bills, and so I can't use money. Again, you can explain in this section about that, even if it doesn't necessarily pertain specifically to the person's disability. So that's just an important part to keep in mind, and that's one of the ways in which this form is going to be answered a little more uniquely for people who might be newer to the country or coming as refugees than it might be answered by someone who was, born and raised in the United States. So the form continues and moves into questions around hobbies, interests, and social activities. A lot of times, again, some of these questions are going to be impacted by the fact that the person is newly arrived and potentially a refugee or asylee. For example, any changes in these activities, the person might say, well, I don't have friends here, or I don't, the hobby that I used to do back home, I can't do here. You can add that in to this section as just more context for the adjudicator to understand what the day-to-day life of your client looks like. Same with social activities. And again, these are the types of questions that can be really traumatic or difficult to answer for some clients, because it's just a reminder that they don't have the social activities that they used to, or they don't have the community that they used to have. So again, just answering those as specifically as possible, but keeping in mind it's okay if some of this is not related to the illness that the person has. And then on the right-hand side of the page, this is one of the sections where I would really encourage adding some remarks if necessary. That first question under information about abilities asks about a number of different mobile tasks and gives you only a few lines to answer if there's any issues with lifting, squatting, bending, standing, etc. I try to get as much detail as I can with this question and write out as much as I need to, and again, using that remarks page if I need to. But that's just an example about the amount of information and the detail that you're asked to describe in a relatively small amount of space. Another important question on this page is the 20C that asks how far can you walk before needing to stop and rest? If you have to rest, how long before you can resume walking? Questions like that, I found that sometimes clients don't really have a good estimate. And so this is another example of where you might need to prompt, are you sitting for longer than 5 minutes? Are you able to walk for a longer period of time than X, Y, and Z? So trying to give examples can be helpful. And then finally, we're coming to the end of the report. On the left-hand side, you'll see that it asks if the person uses any of the following devices, like crutches or walker, and it asks, were they prescribed by a doctor? When was it prescribed? Those are the types of questions that a client might not know the exact answers to. And so again, it's okay to say, if they say, I don't know, then you can just write, I don't know, they don't know. Same with the top of the next page here, the right-hand side, around medications. Someone might know a side effect they have, but they might not know the medication name. Again, you can write that. And then the final section here is around remarks. Again, you can add in information you didn't have room for. You can add in the reasons why maybe something wasn't answered or was estimated, things like that. So now that we've briefly walked through the adult function report, what are some tips for filling this out? I know that this form can be really time consuming. It's probably the most time-consuming part of the SSI application process. But it is also, like I mentioned earlier, one of the most important pieces of evidence that your client can submit to support their claim. So some things that I found useful when doing these reports, use a draft version to take notes. So oftentimes, because that form is so tiny, if you're handwriting the responses at least, it can sometimes be helpful to take notes in a conversation you're having with your client, add in things. You might ask a question later on that prompts an answer to something you already asked. And then that way you can then copy everything over into the final report. If you know that this report is coming, which it should come for every client that you're applying for SSI, you can start on this early, right? You don't have to wait until they receive the report in the mail. If you have a copy of a blank one, you can start maybe asking a couple questions during each of the times that you're meeting with that patient in order to, not have to spend a huge chunk of time doing it all at once. If you are helping a client fill out this form from their perspective, which is most likely how you're going to fill this out, like I mentioned before, there are some cases in which DDS will send you a version of this to fill out from what you've seen and your perspective. But if you're helping a client fill this out, you want to write in first person. So you are acting as if you are the client. And by that, I mean you are asking the client the questions and you're writing down directly what their response is. So you're really just helping them with the piece of not being able to fill this out on their own. And so, for example, if you're asking a question about how long they can walk, you want to write their answer as, I can walk 5 minutes before resting. So it's important that the voice and the perspective that this form captures is from your client directly. This is also where it can be useful to fill out the adult function report from your perspective, because you might know things, or you might have noticed things or seen things that the client doesn't necessarily see that can be helpful. And like I said, you're only going to get that if you're listed in that section in the application of an extra contact that the person has that knows about their medical record. So if you are working on an SSI claim for someone that you think would need a little bit more support in their claim from a different perspective, you can add yourself to that at the beginning. And then I also think using the known context that you have in the rapport and the relationship that you've built with your client can really help with the discussion. Like I mentioned, if they're not understanding the type of question that's being asked, or if you know that they've talked to you about something in the past that maybe they're not remembering, you could kind of prompt that and make sure it's being covered correctly in this form. So one final thing I want to go over in this presentation is what's known as the consultative examination. I mentioned this briefly in a slide earlier in the presentation, but in the cases where DDS has received the application packet from Social Security, they've gathered the medical records from your client's medical providers, they've received the adult function report from your client, and they still feel like they are unable to make a medical determination on the case, there are times that they might request that the client attend a physical and or mental health appointment with a third-party medical provider. Like I mentioned, this is a provider who has never seen the client before, so it's not going to be their primary care provider or a specialist that they've been seen by. DDS will indicate that this exam is needed by sending a letter in the mail with the date and location of the appointment, and this letter will ask the client to respond and confirm that they're able to attend that appointment. They will also provide interpretation and transportation if needed, but the form that they send will ask whether those are both needed, and the client needs to fill out the form and send it back and request both of those items. You can also fill this out for your client and send it back. I have done a lot of these forms and sent them back. They're relatively easy to fill out. Your authorized representation for the claim extends to DDS, So you can also call DDS and the specific representative who is in charge of this claim and verbally respond by saying, yes, this person can make this appointment and they need an interpreter and a taxi ride. And usually that person's information is on any DDS mail that is sent to the client. And DDS mail should also be sent to you as the authorized representative if you are signed on.